Vitamin D is essential for overall health and plays a significant role in cancer prevention. It has numerous mechanisms that help reduce the risk of cancer, and conversely, cancer can deplete vitamin D levels in the body. This dual relationship between vitamin D and cancer reveals why maintaining adequate levels of this vitamin is so crucial in both preventing and combating cancer. Vitamin D's role in cancer prevention. Cellular health and apoptosis. Cell suicide. One of the key ways vitamin D prevents cancer is by helping regulate cell death. In a healthy body, when a cell is damaged, it is supposed to undergo apoptosis, or programmed cell death, to avoid becoming cancerous. Vitamin D plays a critical role in triggering this process, effectively preventing damaged cells from transforming into cancer cells. Regulation of cell growth. Vitamin D helps regulate the growth of cells, preventing uncontrolled cell proliferation. This is important because tumors often form when cells begin to grow uncontrollably. Vitamin D's ability to regulate this growth can inhibit the development and spread of cancer cells. Anti-inflammatory effects. Chronic inflammation is a hallmark of cancer. Vitamin D is known for its anti-inflammatory properties, which can help reduce the inflammation that often accompanies cancerous growths. By mitigating inflammation, vitamin D helps create an environment that is less conducive to cancer development. Nutrient starvation for tumors. Vitamin D can limit the resources available to cancer cells. Tumor cells require nutrients and oxygen to grow, and vitamin D helps regulate factors that limit these resources, effectively starving the cancer cells and preventing their growth. Immune system enhancement. Vitamin D is crucial for the optimal function of the immune system. It helps activate immune cells that are responsible for detecting and destroying cancer cells. By strengthening the immune response, vitamin D increases the body's ability to fight off cancerous cells. Enhanced chemotherapy response. Research suggests that vitamin D can enhance the effectiveness of chemotherapy treatments. By supporting immune function and cellular health, vitamin D may help make chemotherapy more effective in destroying cancer cells. Insulin sensitivity and cancer risk. Vitamin D also helps improve insulin sensitivity. Insulin resistance has been linked to a higher risk of cancer, particularly certain types like breast and colon cancer. Vitamin D's role in improving insulin function may, therefore, indirectly reduce cancer risk. Cancer-suppressing gene regulation. Vitamin D can downgrade the expression of certain genes that promote cancer growth, thus contributing to cancer prevention at the genetic level. Support for the gut microbiome. The gut microbiome plays a pivotal role in immune health, and vitamin D is known to support its balance. Since approximately 80% of the immune system resides in the gut, maintaining a healthy microbiome with adequate vitamin D can support immune surveillance against cancer. How cancer disrupts vitamin D function. Cancer cells create an environment that actively disrupts the body's ability to use vitamin D. Hypoxia. Low oxygen levels. Cancer cells thrive in low oxygen environments, a condition known as hypoxia. This lack of oxygen can block the absorption and activation of vitamin D, limiting its effectiveness in fighting cancer. Acidic tumor microenvironment. Tumors often grow in an acidic environment, which is not conducive to proper vitamin D function. This acidity interferes with the body's ability to use vitamin D effectively, making it harder to combat cancer. Vitamin D conversion blockage. Vitamin D needs to be converted into its active form for the body to use it effectively. However, cancer cells often block the enzymes required for this conversion. Additionally, cancer can cause damage to vital organs, such as the liver and kidneys, where vitamin D conversion primarily occurs. Parathyroid gland involvement. The parathyroid glands, which are located next to the thyroid, play a role in regulating calcium levels in the body. Tumors often produce a hormone similar to the one produced by the parathyroid gland. This hormone extracts calcium from bones to meet the cancer's survival needs, but it also inhibits vitamin D absorption. High levels of calcium in the blood, hypercalcemia, are common in cancer and contribute to vitamin D deficiency. Addressing vitamin D deficiency in cancer. Given the crucial role that vitamin D plays in preventing and fighting cancer, it is important to ensure sufficient levels of the vitamin, especially for those diagnosed with cancer. Here's what the research suggests. Higher doses of vitamin D. For cancer prevention and support, vitamin D doses should be higher than the typical recommended amounts. The body requires more vitamin D to fight cancer, and it is suggested that a daily intake of 10,000 to 50,000 IU of vitamin D may be beneficial in cases of cancer, along with additional nutrients such as magnesium, vitamin K2, and zinc. Magnesium and other supplements. Magnesium is essential for the activation of vitamin D, and supplementing it can help ensure that vitamin D works effectively in the body. Other supplements that may support cancer prevention include omega-3 fatty acids from fish oils or cod liver oil, resveratrol found in grapes and berries, curcumin from turmeric, berberine helps with blood sugar regulation, and probiotics, which support gut health. Lifestyle modifications. Lifestyle changes can help improve the body's ability to absorb and use vitamin D. For instance, regular exercise can increase vitamin D receptor activity, while intermittent fasting has been shown to improve insulin sensitivity. Reducing stress is also vital, since high levels of cortisol can inhibit vitamin D absorption. Exposure to light. Light, particularly infrared light, can help boost melatonin levels, which in turn can improve vitamin D absorption. Spending time in the sunlight also naturally helps the body produce vitamin D. Vitamin D plays a crucial role in maintaining overall health, especially when it comes to the prevention and management of diseases like cancer. However, when cancer develops, the body's ability to utilize vitamin D becomes compromised in several ways. As mentioned earlier, cancer cells thrive in an environment characterized by inflammation, hypoxia, lack of oxygen, and acidic pH levels, all of which can obstruct the absorption and effectiveness of vitamin D. Cancer and vitamin D deficiency. One of the critical issues with cancer is how it impacts the organs involved in vitamin D metabolism, namely the liver and kidneys. These organs are responsible for converting inactive vitamin D into its active form. In the presence of cancer, damage to the liver and kidneys can impair this conversion, leaving the body with insufficient active vitamin D. Additionally, cancer can influence the parathyroid glands. These small glands, located next to the thyroid, are responsible for regulating calcium levels in the body. When cancer is present, it can produce hormones similar to those made by the parathyroid glands, leading to an excess of calcium in the bloodstream, a condition known as hypercalcemia. This hypercalcemia can inhibit vitamin D activity, creating a vicious cycle. The high calcium levels in the blood reduce the body's ability to activate vitamin D, further compounding the vitamin D deficiency associated with cancer. Consequently, the body's immune system becomes weakened, making it harder to fight cancer. The parathyroid glands and cancer. The parathyroid glands play a vital role in regulating calcium levels in the blood. When cancer cells produce a hormone that mimics the parathyroid hormone, it causes calcium to be extracted from the bones, which can lead to elevated calcium levels in the blood. While this might serve as a survival mechanism for the cancer, it also disrupts the balance of vitamin D in the body. Excessive calcium in the blood inhibits the action of vitamin D, making it even more challenging to combat the cancer. This connection between high calcium levels, parathyroid hormones, and vitamin D activity is why maintaining proper vitamin D levels is essential, especially for those diagnosed with cancer. Unfortunately, cancer's impact on the parathyroid glands can further disrupt the body's vitamin D metabolism, leading to a more aggressive disease progression. Vitamin D and immune system support. Vitamin D's role extends beyond just supporting bone health and calcium regulation. It is crucial in modulating the immune system. The immune system relies on vitamin D to function properly, and a deficiency can impair immune responses, making it easier for cancer cells to proliferate. This is why vitamin D is so important in cancer prevention, It helps regulate the immune system and enhances the body's ability to fight off abnormal cells, including cancerous ones. Research has shown that vitamin D enhances the effectiveness of chemotherapy, making it a critical adjunct to cancer treatment. It also helps improve insulin sensitivity, which is important because insulin resistance is often associated with an increased risk of developing cancer. Furthermore, vitamin D helps regulate genes responsible for cancer development, offering an added layer of protection against cancer cell proliferation. Vitamin D as an anti-cancer agent. Vitamin D is increasingly recognized for its anti-carcinogenic properties. Studies have shown that individuals with higher levels of vitamin D tend to have a lower risk of developing certain types of cancer. Vitamin D helps prevent the transformation of normal cells into cancerous ones, primarily by triggering cell apoptosis, programmed cell death, in damaged cells. This is one of the body's natural defense mechanisms, and vitamin D is a key player in ensuring this process occurs effectively. In addition, vitamin D is known for its anti-inflammatory properties, which are essential because inflammation is one of the hallmarks of cancer. Chronic inflammation can promote cancer development, but vitamin D helps regulate the immune response and control inflammation, preventing the inflammatory environment that cancers thrive in. The solution: boosting vitamin D levels. Given the critical role that vitamin D plays in cancer prevention and management, it's essential to maintain optimal vitamin D levels, especially in individuals at risk for or diagnosed with cancer. For cancer prevention, a daily dose of vitamin D is recommended, ideally in the range of 10,000 to 50,000 IU per day, depending on individual needs and health conditions. In addition to vitamin D supplementation, magnesium, vitamin K2, and zinc are also important as they help facilitate the absorption and utilization of vitamin D in the body. It's important to note that while vitamin D can play a role in preventing cancer and supporting treatment, it is not a cure for cancer. However, research from organizations like the World Health Organization (WHO) recognizes vitamin D's significant role in reducing cancer risk, making it an important part of any preventive health strategy. Additional epigenetic factors and lifestyle changes. To further support vitamin D's effectiveness, certain lifestyle changes and supplements can be beneficial. Magnesium, omega-3 fatty acids, found in fish oils or cod liver oil, resveratrol, found in grapes and berries, curcumin from turmeric, and berberine, which helps with blood sugar regulation, are all substances that can help enhance the body's ability to absorb and utilize vitamin D. Additionally, engaging in intense exercise and intermittent fasting can help improve vitamin D receptor activity, allowing the body to better utilize vitamin D. Sulforaphane, a compound found in broccoli sprouts, and ginger are also known to support vitamin D metabolism. A lower carbohydrate diet, especially for those with insulin resistance, can further improve vitamin D absorption and reduce the risk of cancer. Probiotics, which support gut health, can also play a role in improving vitamin D absorption. Certain light frequencies, such as infrared light, can help increase melatonin levels, which in turn can improve the absorption of vitamin D. Lastly, managing stress is crucial, as high levels of cortisol and adrenaline can inhibit the body's ability to absorb vitamin D. The toxicity of vitamin D and caution. While vitamin D is essential for health, it is important to be mindful of toxicity. Taking too much vitamin D can lead to harmful side effects, including calcium buildup in the blood, which can cause kidney stones, nausea, and weakness. It's crucial to monitor vitamin D levels with the guidance of a healthcare provider to ensure safe and effective supplementation. Vitamin D is a powerful tool in cancer prevention and management, as it helps regulate immune function, inflammation, and cell growth. It's critical to maintain adequate vitamin D levels, particularly for those at risk of cancer, to optimize the body's defense mechanisms. By combining vitamin D supplementation with other lifestyle changes and supplements, individuals can better support their immune system and reduce the risk of cancer development. The role of vitamin D in cancer treatment and recovery. In addition to its preventive properties, vitamin D has shown promise as a supportive agent in cancer treatment and recovery. Many studies have demonstrated that adequate levels of vitamin D during cancer treatment can improve outcomes, enhance the effectiveness of therapies, and reduce side effects. For example, patients undergoing chemotherapy or radiation therapy often experience weakened immune function, fatigue, and inflammation, all of which vitamin D can help mitigate. Enhancing chemotherapy and radiation effectiveness. Vitamin D's role in supporting cancer therapies is significant. Research indicates that vitamin D can make chemotherapy and radiation therapies more effective by sensitizing cancer cells to these treatments. Cancer cells are often resistant to conventional therapies, but vitamin D has been shown to induce cell cycle arrest and apoptosis in cancer cells, thereby enhancing the ability of chemotherapy and radiation to kill the tumor cells. In particular, vitamin D's involvement in regulating tumor suppressor genes, such as the p53 gene, is noteworthy. This gene plays a crucial role in controlling cell division and preventing the growth of tumors. Vitamin D helps activate this gene, allowing it to suppress the growth of cancerous cells and make them more susceptible to treatment. Additionally, the anti-inflammatory effects of vitamin D can help reduce the inflammation caused by cancer treatments, potentially improving the patient's quality of life during the treatment process. Reducing cancer treatment side effects. Cancer treatments like chemotherapy and radiation therapy can cause a range of side effects, including fatigue, weakness, bone pain, and cognitive issues, often referred to as chemo brain. Adequate vitamin D levels may help reduce these side effects. For instance, vitamin D plays an essential role in bone health and calcium metabolism. This can help prevent the bone loss that is often a side effect of chemotherapy, particularly in cancers like breast cancer or prostate cancer, which impact bone density. Vitamin D is also involved in regulating immune cell function, which is crucial for recovery during and after cancer treatments. Low levels of vitamin D have been associated with increased inflammation and delayed recovery from illness. By maintaining optimal vitamin D levels, patients can support a faster and more effective recovery process. Supporting immune function during cancer treatment. Cancer treatments, especially chemotherapy and immunotherapy, can significantly weaken the immune system. Vitamin D, known for its immune-boosting properties, plays a key role in regulating immune responses. It helps activate and regulate T cells, which are essential for the immune system's ability to identify and fight off abnormal cells, including cancer cells. Moreover, vitamin D influences the production of antimicrobial peptides that defend the body against infections, another concern for cancer patients whose immune systems are compromised. By improving the body's ability to ward off infections, vitamin D helps cancer patients remain healthier during treatment and reduce the likelihood of complications. Vitamin D and cancer survivorship. After successful cancer treatment, maintaining proper vitamin D levels is important for long-term survivorship. Studies have shown that cancer survivors who maintain sufficient levels of vitamin D may have a lower risk of cancer recurrence. This is especially true for cancers such as breast, prostate, and colorectal cancers. Survivors of cancer often face increased risks of osteoporosis, cardiovascular disease, and metabolic disorders as a result of the treatments they undergo. Vitamin D, along with other nutrients like calcium and magnesium, helps support bone health, reduces the risk of fractures, and promotes cardiovascular health. Vitamin D's anti-inflammatory properties also continue to play a role in reducing the chronic inflammation that can occur following cancer treatment, which has been linked to the development of secondary cancers and other health complications. The importance of personalized vitamin D supplementation. Given the various roles vitamin D plays in cancer prevention, treatment, and recovery, it's essential that individuals tailor their vitamin D intake to their specific needs. Factors such as age, body weight, existing medical conditions, and geographical location, which affect sun exposure, all influence the amount of vitamin D a person requires. For cancer patients, monitoring blood levels of vitamin D is critical to ensure they are receiving enough of this vital nutrient without risking toxicity. A healthcare provider can assess individual needs and recommend the appropriate dosage. For instance, cancer patients may need higher doses of vitamin D during active treatment or recovery phases compared to the general population, especially if they have low baseline levels or if their liver or kidney function is compromised. The ideal blood levels of vitamin D are generally considered to be between 30 and 60 nanograms per milliliter. Levels lower than this range may indicate a deficiency, while levels higher than 100 nanograms per milliliter may be considered excessive and potentially harmful. Regular testing and adjustments to supplementation ensure that cancer patients receive the maximum benefits of vitamin D without adverse effects. Vitamin D and its synergistic effects with other nutrients. Vitamin D's cancer-fighting benefits are amplified when paired with other nutrients. As mentioned previously, magnesium is an essential cofactor for the activation of vitamin D. Magnesium helps enhance vitamin D absorption and assists in the conversion of vitamin D into its active form. Therefore, ensuring adequate magnesium levels in addition to vitamin D can boost its effectiveness. Additionally, vitamin K2 works synergistically with vitamin D to ensure that calcium is properly deposited in the bones rather than in soft tissues. This is particularly important for cancer patients, as some cancer treatments can lead to calcium imbalances. A proper balance of vitamins D and K2, along with magnesium, promotes optimal bone health and supports the immune system. Omega-3 fatty acids, found in fish oil, can also work alongside vitamin D to reduce inflammation. Chronic inflammation is a significant contributor to cancer progression, so incorporating omega-3s into the diet, along with vitamin D, can help reduce the inflammatory environment that cancer cells need to thrive. Vitamin D is a vital nutrient for cancer prevention, treatment, and recovery. It supports immune function, reduces inflammation, and helps prevent the transformation of normal cells into cancerous ones. For cancer patients, maintaining optimal vitamin D levels can enhance the effectiveness of chemotherapy and radiation, improve recovery times, and reduce the risk of side effects. As research continues to uncover the myriad benefits of vitamin D, it is becoming increasingly clear that this nutrient should be an integral part of cancer care. Personalized vitamin D supplementation, in combination with other lifestyle changes, can help cancer patients lead healthier, more resilient lives. While vitamin D alone is not a cure for cancer, its role in supporting the immune system and overall health makes it an essential component in cancer management and survivorship. Vitamin D's role in cancer prevention, treatment, and survivorship cannot be overstated. From its ability to regulate immune function and reduce inflammation to its direct effect on tumor cells and hormone regulation, vitamin D is a crucial ally in the fight against cancer. For those undergoing cancer treatment, adequate vitamin D levels can improve treatment effectiveness, reduce side effects, and enhance recovery. For cancer prevention, maintaining optimal vitamin D levels, combined with a healthy diet, regular exercise, and stress management, can help create an environment in the body that is less conducive to cancer growth. As research continues to reveal more about the intricate relationship between vitamin D and cancer, it is becoming increasingly clear that this nutrient is essential not only for bone health and calcium metabolism, but also for preventing and managing cancer. By taking proactive steps to ensure adequate vitamin D levels, individuals can empower themselves in the fight against cancer and improve their long-term health outcomes. In summary, while vitamin D is not a cure for cancer, its role in supporting the immune system, reducing inflammation, and preventing cancer cell proliferation makes it a key component in cancer care and prevention. Taking steps to optimize vitamin D levels, along with adopting a healthy lifestyle, could significantly enhance cancer prevention efforts and improve the quality of life for cancer patients and survivors alike.